Why do people still smoke? A doctor's honest reflection on addiction, pain, and hope. By Dr. Anika Mehra, pulmonologist and addiction recovery specialist. Hello, I'm Dr. Anika Mehra. Before I begin speaking to you as a doctor, I want to speak to you as a fellow human being. One who has seen the effects of smoking, not only in medical charts and x-rays, but in the pain-stricken eyes of patients, in the trembling hands of families, and in the tears of those left behind. Despite decades of research, warnings on every cigarette pack, horrifying statistics, and public health campaigns, one haunting question remains. Why do people still smoke? Let's be honest, smoking kills. It causes cancer, lung, throat, mouth, bladder, stomach, pancreatic, and more. It destroys the lungs, leading to COPD and emphysema. It thickens the blood, raises blood pressure, weakens the heart, and triggers strokes. It discolors teeth, accelerates aging, reduces fertility, and increases the risk of diabetes. And yet, people still smoke. Why? The answer is not as simple as they don't care. It is not because they are ignorant. Most smokers I've treated know the risks better than anyone. So let me take you deeper, beneath the surface, into the emotional and psychological trenches where addiction thrives. The first cigarette, a story that begins in pain or pressure. Most smokers didn't start smoking in their 30s or 40s. They started as teenagers, 15, 16, maybe even younger. In those fragile years, a cigarette isn't a death wish. It's a ticket to belonging, a rebellion, a coping mechanism. I remember a patient, Rakesh, who told me his story with tears in his eyes. "My father used to beat my mother," he said. "I'd hide in the back of the house and cry. One day, my cousin gave me a cigarette. He said, 'This'll calm you down.' And it did." That was the beginning. Cigarettes became his therapy, his escape, his control over a world that seemed to crumble around him. Another patient, Aisha, began smoking in college. She had lost her mother to suicide. "I didn't want to die," she told me, "but I didn't want to feel either." Cigarettes numbed her. She felt in control of her pain, just for a while. Peer pressure, trauma, anxiety, low self-esteem, these are the real triggers. People often don't smoke to die. They smoke to survive. Nicotine, a ruthless chemical companion. Nicotine is not just a habit. It's a substance more addictive than heroin or cocaine. It changes the brain. It hijacks reward pathways. After just a few cigarettes, the brain starts expecting it, demanding it. Withdrawal is brutal. Irritability, anxiety, depression, headaches, trouble sleeping. It's not a lack of willpower. It's neurochemistry. Smokers don't light up because they love the taste of tobacco. They light up because their brain screams for relief. It's a cycle. Stress leads to smoking. Smoking leads to temporary relief. That relief fades. Stress returns, stronger, and the brain remembers. Smoke again. The body becomes enslaved. Even when the mind wants to quit, the body won't cooperate. The role of mental health and emotional trauma. As a doctor, I've found that many long-term smokers are also fighting unseen battles. Depression, anxiety, PTSD. Smoking becomes a self-prescribed medication. For people with bipolar disorder, smoking may stabilize the mood for a moment. For trauma survivors, it offers a minute of quiet. For the lonely, it's company. For the grieving, it's solace. But the problem is this: it never heals. It only numbs. And just like any numbing agent, when it wears off, the pain returns, deeper and darker. The social web, culture, identity, and belonging. In many parts of the world, smoking is not just a personal choice. It's a social ritual. In India, for example, a bidi, or cigarette, after tea, is woven into the daily routine. Among men, it's seen as a sign of masculinity. Among the stressed, it's seen as normal. In movies, smoking is still portrayed as glamorous, edgy, mysterious. These images stick. For some, giving up smoking feels like giving up a part of their identity. "I won't know who I am without it," a 38-year-old man once told me. We often underestimate how much smoking is tied to emotion and environment. When someone decides to quit, they're not just fighting a physical addiction, they're dismantling years of emotional scaffolding. Side effects. The body's silent suffering. Let me walk you through what smoking does to the human body, because sometimes knowing the science can give strength to the struggle. Lungs. Smoking damages the tiny air sacs in your lungs. It causes chronic bronchitis, irreversible emphysema, and lung cancer. You lose your breath faster. Walking becomes difficult. In late stages, even talking is hard. Heart. Smoking narrows your blood vessels. It increases clot risk. Smokers are twice as likely to have a heart attack. And if you already have high blood pressure, the risk triples. In brain, it increases the risk of stroke by narrowing arteries. Nicotine also affects memory and mood regulation. Skin. Smoking reduces oxygen and nutrient flow to the skin. It causes premature aging, wrinkles, and dullness. Mouth and throat. It leads to oral cancers, gum disease, and tooth loss. Stomach and reproductive system increases ulcers, infertility in both genders, erectile dysfunction in men, and complications during pregnancy for women. And then, of course, there's cancer. Lung cancer is the most common cancer caused by smoking. But it's not alone. Smoking is linked to over 15 different types of cancer. Why don't people just quit? Because quitting is hard. Imagine having to give up the one thing that brings you comfort when you're alone, or when your hands tremble with anxiety, or when you walk past the place where your mother died and your brain whispers, "Just one puff to feel better." Nicotine is not the only monster. Loneliness, trauma, grief, they're all part of the addiction. And sadly, society still shames smokers instead of supporting them. We say, "You know it's bad for you," as if they didn't already cry about that last night. Hope, healing is possible. But here's the truth I want every smoker to hear. You are not weak, you are wounded, and wounds can heal. I've seen patients who smoked for 40 years quit. I've seen grandfathers throw away their last cigarette after seeing their grandchild born. I've seen women light their last beady on the day they walked into therapy. It's not easy, but it's possible. There are tools: nicotine patches, gums, lozenges, prescription medication, cognitive behavioral therapy, group support, hypnotherapy, meditation and mindfulness, healthy routines to replace old habits. Recovery is not linear. You may relapse, you may cry, but every attempt you make chips away at the chains. A message to non-smokers: show compassion. If you love someone who smokes, don't shame them. Ask them how they're feeling, sit with them in silence, offer help without judgment. Let them know their life matters. Because sometimes, that's all it takes to start the journey. Final words: you are worth saving. To those who smoke and are trying to quit, you are stronger than your cravings. You are more than your addiction. You are a human being, deserving of a healthy, full life. Yes, smoking causes cancer. Yes, it harms nearly every organ in your body, but you are not hopeless. You are not alone, and you are not beyond healing. Start small. Start today. Choose to live, not just exist. Because your story isn't over. And we, your doctors, your families, your friends, we believe in your tomorrow.